Welcome back to Stories Behind the Scrubs, where we dive into the world of medicine through the stories and experiences of those on the front lines. I'm Jada, and I'm here with my co-host Emlyn.
Each episode, we have the privilege of sitting down with inspiring individuals from all walks of the medical field, whether it's child life specialists, paramedics, medical students, or practicing physicians. We chat with them about their careers, personal journeys, challenges, triumphs, and everything in between.
Today, we're joined by Dr. Zienna Blackwell, who's here to share her unique path in medicine, including her experiences in the military, nursing, and public health. Well, first of all, thank you so much for joining us today. I had the privilege of hearing you speak as a guest speaker, where you shared a lot of really interesting stories from experience that you've had in public health. So we're looking forward to hearing some of those today. But before we get into that, we're just going to spend a few minutes in the earlier parts of your life. So when you were in high school, did you know that you were interested in medicine, or did you have other plans for the future?
Actually, I had wanted to be a veterinarian, but I found out I was very allergic to cats. And so that wasn't going to work out for me in the long term. And so I actually went to the military in after high school. And it was through combat life-saving training and an opportunity to the Green to Gold program in the Army that I ended up in nursing.
Okay, we were not expecting you to say that you went to the military. Okay, can you talk a little bit more about how your experience in the military kind of led you into nursing?
So I went into the Army. I actually I graduated early. So I was 16 when I graduated from high school and went to community college. Like I said, wanted to be a vet, and that didn't work out and didn't really know what I wanted to do. So after getting an associate's degree in just general science classes, I went to the Army and was one of the first women in a combat position. And so I was air defense artillery, trained on the Hawk missile system. And that basically ended up in the Gulf War, and upgraded to the Patriot missile system and shot down Scud missiles, basically. And so then I had the opportunity in the military to become a combat lifesaver, which was a field medic, basically, and really enjoyed that training. And was offered the Green to Gold program, which was an opportunity where there was a shortage of nurses in the Army. And so they would pay for you to go to nursing school, and then in return, you got your active duty pay and everything, and in return, then you served another 4-year term after graduation. And so that's what sparked my interest, but decided not to stay in the military that long, and instead got out and used my GI Bill to become a nurse. But in the interim, I still needed to work. And so I was an EMT to pay the bills as I went to nursing school. So kind of an interesting path into nursing.
Yeah, definitely a very non-linear path, not what we expected to hear either. As you mentioned earlier, you sort of got into the military um, after deciding that being a veterinarian wasn't going to be that fit for you, and you were hoping to find some direction there. Um, when you became like a combat medic and when you were offered that Green to Gold program, did you take the opportunity because it seemed like the next logical step, or did you find that you had more of a passion for nursing and patient care at that point?
I think it was a combination of the two. I really hadn't had the exposure to dealing with patients as far as, the medical field. Grew up on a farm, so had a lot of interaction, with animals, but not so much people living in a rural community. And so it was that opportunity as a combat lifesaver to actually be able to do the emergency medicine on people that was like, oh, this is kind of cool. And they can talk to you and animals can't. So that's kind of what started the nursing journey.
Yeah, that sounds like a super cool experience. And again, definitely not what we were expecting. But you did talk about how you were offered that Green to Gold program and you were able to go to nursing school. So, for those of our listeners that are interested in nursing, can you talk a little bit about what they should be looking for in a nursing program and maybe what your thought process was when you were trying to pick the right place for you?
Yeah, absolutely. I think, you know, nursing programs have changed so much over the years, and there's a lot of programs that focus on different areas. Definitely, I also have a different experience in nursing school in that I didn't initially go to a four-year university for a bachelor's in nursing, which so many people do today. But as I mentioned, I had gotten out of the military and then used my GI Bill to pursue nursing. And I grew up in Iowa, very rural farm area, and there was not easy access to four-year universities. And so I would have had to relocate away from family again. So I started with a two-year associate's degree in nursing at a community college, and then went on to get my bachelor's degree, master's, and finally a doctoral program. So I think it really truly is about where you are in life, and are you able to commit to 4 years at once, or do you need to, get into the workforce and start earning some money? And so that's how the associate's degree program kind of fits in if you're really needing that quick income. But I would never recommend anyone to stop with an associate's degree. We really do need leadership in nursing. And so I would highly encourage people to, pursue those higher level degrees, especially a doctoral degree in nursing, because not only do we have nursing shortages, but that also leads to a shortage in the leadership capacity in the profession.
Yeah, I see what you mean. And I was hoping we could get a little bit more into that. Because I think for a little more context, I should say on your behalf that you have a DNP, a Doctor of Nursing Practice.
Correct.
And I was curious, like, what the benefits are of getting a doctorate degree in nursing versus being able to work in just 2 years. And like you said, 2 years could be good to make, like, to start earning as quickly as possible. But what helped guide, like, your personal choice into, pursuing, like, essentially, like, a terminal level, like, nursing degree?
Well, so first of all, there's a PhD route and then the DNP route in nursing. And the reason that I chose the DNP over the PhD is I'm more interested in taking the research and being able to put that into practice versus doing the research. And so the PhD side is very much research focused, where the DNP actually implements that research. And there's such a gap in the time from the research being completed to implementation. It's often sometimes 10 years before that happens, because especially in nursing, there's not enough DNPs to actually take that research and have the leadership to implement that. And so that's why I chose that side. But those of you that are familiar with nursing, you know that it's a very physically taxing profession. And so as an associate's degree nurse, you are basically sentencing yourself to a life on the floor. And it's great. Patient care is wonderful, and that opportunity to interact with patients and their families. But as you age, which you might not think about in your 20s, but even 10 years of working in nursing, we start to see knee pain, back injuries, things like that, because the 12-hour shifts and the lifting patients and all of those things do take a toll on our bodies. And so the projection of your career, most folks aren't able to stay as a floor nurse through retirement just because of that taxing nature on your body. And so also I'm the person that really wants to make a bigger impact. I'm a very big picture thinker. And as a floor nurse, you're usually, only doing patient care and not involved in policy development or the implementation of research and those sorts of things. And that is really what interests me, is to have that bigger impact. And so that's why I pursued the terminal degree.
Yeah, it sounds like your decision to pursue your DNP was, pretty well made based on the fact that you knew that a career just working on the floor was not going to be very sustainable for the long term. But you did mention some of the stuff that you are able to do as a DNP, but can you maybe share, an impactful moment that you had from your time working as a DNP, talking a little bit more about exactly what it is you guys do?
Really, so many things, and I'm in a kind of shift because as a bachelor's prepared nurse, I worked in the hospital and worked on all the floors essentially as a float nurse, and then many, many years in the emergency department. And it was the emergency department. I by that time I had a master's degree and was pursuing a DNP. But really the time in the emergency department really prompted the need for the DNP, in that I was seeing really evident systems level issues, in that people were coming to the emergency department for things that didn't belong in the emergency department because they didn't understand the healthcare system. There was a lack of health literacy. There was lack of access, and just so many barriers to people accessing care outside of the emergency department. And so that's when I really shifted my focus and pursued not only a DNP, but a nursing career in public health.
Right, I find that very interesting. That you spent like years, sort of like attaining your your DNP degree. And I think so. You sort of just mentioned it, but like I guess it was a lot of the cases that you'd seen in the emergency room that made you realize that there's like something deeper going on. And because you're more of a bigger picture person, after spending years working as a nurse, you switched into a career in public health. So if you could just expand a little more about like why you moved into a different role that's still within like the healthcare system.
Yeah, and absolutely needed my nursing license in public health. So worked as, when I first switched to public health, the reason was I really wanted to be able to fix some of the systems that were broken that led people to be overutilizers of the emergency department. And so public health, I went from years of experience in the hospital to no experience in public health. So kind of took a step back and started in public health as a frontline public health nurse, where I was doing home visiting for pregnant moms or families that had newborn babies, and providing health education and doing home assessments and things like that. And also had a caseload of court ordered visitation for families that were either going to lose children or were just getting children back. And so really providing that nursing education and assessment in those homes to assure that children were thriving and that parents had the skills to take care of their children. And so just continued to work up through the ranks, became a program manager, learned how to write grants and whatnot, and eventually through multiple promotions ended up to be a public health director. And again, the reason ended up there was just to have that bigger impact of really improving the health of communities, creating policies that impact health. And, there's not a day that goes by in my public health career that I didn't use my nursing skills, whether that was assessment or, implementation, developing care plans, but for communities instead of individuals. And so it was definitely a natural progression for me. And yeah, and then the pandemic happened. And so that's how I ended up here.
Yeah, so it seems like, I mean, you covered a lot already, and we'll definitely get into more about what you do as a public health nurse and then more the public health sector in general. But you did briefly mention a couple of things that you were able to do as a public health nurse, and I think a lot of people don't really know what that is. So it's not necessarily like you're working in a hospital like most people think of nurses, but then you're not really just sitting at a desk like we envision a lot of public health officials to do either.
Right.
So can you talk a little bit about, I mean, for lack of a better word, I guess the less traditional experiences you've had in the role? Because I know that's where a lot of your stories came from
Yeah.
when I first heard you speak. And I think that's something that our listeners would really enjoy hearing about.
Okay, sure. So yes, as you said, public health nursing is not necessarily in an office or in a hospital. Public health is really about meeting people where they are. And so public health nursing is the safety net basically for people that don't have access to care. It's also looking at systems and policies. It is literally looking at the health of a population or a community. And so in public health nursing, you can do anything from disease control, whether that's monitoring influenza outbreaks, COVID, sexually transmitted infections, tuberculosis, anything that could be infectious and create health issues in a population. That's also looking at walkable neighborhoods, that's looking at food deserts, that's looking at implementing policies around smoking and vaping and sugary beverages. And so it really affords the opportunity for you to explore your passion. You know, if you're really interested in sexual health, there's a place in public health. If you're interested in healthy eating and exercise, there's a place in public health. If you're interested in air quality, I mean, it's a really comprehensive area that, again, you get to make an impact that is either on a state or national or community level, but you can also work with families, you know, like I said, doing home visiting. There's just so many areas, and everything in our environment impacts our health. And so that's really essentially what a public health nurse does. We look at trends and data and create opportunities for health and assure that people have the resources to achieve health.
And a quick clarifying question that I had was when you were a nurse and you sort of saw like these systemic issues being manifested, like especially in the emergency room, and you decide that, okay, I think public health is something I want to pursue, is this something that requires additional education or a certification, or it's more just like if you express interest, like a genuine interest in learning about the field, then like is there a path, like a traditional pathway there, or do you sort of just like forge your own path?
Yeah, public health is kind of a niche area, and it's very underrepresented, and there's not a lot of education in your nursing programs traditionally about public health. So I think that it does remain kind of underserved in that people aren't sure how to get into that. So that's a great question. Number one, you have to have a minimum of a bachelor's degree to be a public health nurse. Depending on where you're trying to apply, whether that's a health department or a nonprofit, those sorts of places, they do vary in experience level. Some health departments will accept new grads, others won't. There's 2 states in the nation that do require a certificate in public health, and those are Minnesota and California. The rest of the states do not. And so both Minnesota and California, there's some additional coursework that you have to take in order to be a public health nurse, but other states, it's just a bachelor's degree.
And then you mentioned earlier that, you know, there are so many ways to get involved in public health. Public health encompasses literally everything. So what were some of the initiatives or opportunities that you personally were involved in or took advantage of as a public health nurse?
Yeah, so some of my best opportunities in public health nursing were when I worked in the state of Alaska as a public health nurse, and I was um, the regional public health nurse manager for an area that was geographically the size of Oregon, but only had a population of 22,000 people, and they were spread out in 56 villages, and they were all Native Yupik, Alaska Eskimo population. And so living out there was very much like a third world country in that the villages, most of the villages didn't have water or sewer infrastructure. They were all off the road system. So the only way to get to Bethel or the villages that I served was by airplane, dog sled, snow machine, four-wheeler, drive on the ice highway, or go by boat. And so we would go out as public health nurses to provide services in the village, and we were pretty much the only access to nursing healthcare in the village. Some of the villages had a clinic that was staffed by a community health aide, which basically was a layperson trained to do basic first aid and things like that. But we would go out and provide STI testing and treatment. We would provide immunizations, all sorts of nursing services in the villages. And we would have to travel with about 400 pounds of gear because in addition to all the supplies that we needed to do our work, we also had to take a sleeping bag and all of our food because there's not hotels or grocery stores or anything like that in the villages. And so some of those initiatives that I was able to implement, I created a curriculum that the CDC asked me to present on for training DOT aides, which is directly observed therapy, which is required for TB treatment to assure that there's compliance with taking the medication for patients that have active TB. And so, as you can imagine, it's very difficult for public health nurses to observe daily medication in villages that we had to fly to. And so I created a training curriculum in partnership with some other nurses that I worked with to train local community members to be able to monitor the TB patients and make sure they took their meds. And so that was a really awesome opportunity. And then being asked by the CDC to present that through their education and training network was quite the honor. Some of the other initiatives were implementing a syringe access program and that was a result of multiple children getting needle sticks on the school playground from dirty needles being left around. So we were able to implement that. The list goes on. I implemented expedited partner therapy again because it's hard to get treatment to partners that have tested positive for STIs, and so created the program where we could provide the treatment for the number of partners to the person that came in and tested positive, and they were able to distribute that. So it's just been an amazing opportunity to be able to implement policies and procedures that impact large communities or states.
Yeah, it sounds like you've done a lot and you've been involved in a ton of different programs. But people who go into public health, or even nursing for that matter, are probably not going into it assuming that they're going to be doing like this kind of work out in the field. So were you aware when you got into it exactly what you were getting into? And I mean, if not, how did you deal with maybe culture shock is not the right term, but you guys are in a very different environment with very different challenges and stresses than you have in other areas. So how did you deal with that?
Yeah, it's interesting because in the hospital, you're in such a controlled environment and you have housekeeping and you have air conditioning and all of those sorts of things. And even public health in the lower 48 in the states that I've worked in, um, some of the homes you go into are very challenging. I mean, um, I've been in homes that there are so many cockroaches that you're just constantly stepping on bugs. I've been in places that are so dirty that you don't want to set your equipment down, either because of the bugs or the dirt. And I've been in environments where there are drugs laid out on the coffee table. And so, it's one of those things that, or, even in Alaska, they, with no water and sewer infrastructure, and someone's using the bathroom in a bucket called a honey bucket. And so you encounter different environments that may smell differently or aren't necessarily clean, and you're trying to provide services like, drawing blood or giving vaccines or whatever, that you really need to have a clean space to work in. And so it's really, you really need some resilience in yourself. And you have to have a poker face, because you can't go in and make a face at somebody's living situation or the smells or the things that you acquire, and you do a lot of gritting your teeth and putting a smile on your face, because it's about, not shaming them either, because they're in that situation for a reason, and usually it's not by choice, it's by addiction or poverty or other things that have led up to that. And just to remember to be non-judgmental and to maintain that professional demeanor, and to really be approachable and not have that, reaction, so that you are able to build trust, because you're going into these people's spaces, and so it's important that they trust you and don't feel judged.
Yeah, I think you've definitely described some very challenging situations, and at least that shows me that this is not a profession for the light of heart. And I think I especially like what you said at the end, that it's very important to be building trust with your patient, and I guess having a general sense of empathy, just because we don't know what put them in the conditions that they're in now. Um, but hearing you talk a little bit about that reminded me, or prompted me to ask, what do you find like most rewarding about being a public health nurse? Because I know when people consider like pursuing a career in medicine, oftentimes it's to like the general phrase is like, oh, I just want to help people. And they're usually envisioning like direct patient care. Based on what you've described, you sort of work both on a systemic level, but it sounds like you're still having those like person to person interactions. So, like, do you feel like this has evolved your approach to patient care?
Oh, 100%. I feel like the best part about being a public health nurse is that you get to work at all those levels. Like you said, you get to work with the individual, the family, the community, and the public at large, and at a systemic level for policy. And so the great part of being in public health versus the hospital is you work in a hospital and you take care of that patient and maybe their family, and then they go home and you never hear from them again, or you never, like, did their health improve? Like, you only see them if their health deteriorates and they come back. Whereas in public health, we usually see that patient over and over. We build that relationship. We tend to have familial relationship, in that I've had patients that as a public health nurse that I started seeing as a child and gave immunizations to, and now I'm doing the same with their children. And so really seeing that impact. But when you go into someone's home or environment and you see those things of, they might not have power or water or heat, or their house isn't clean, and there's drugs on the table, or all of those sorts of things. You get the opportunity to really try to figure out what's the root cause of that. It's like, are there mental health concerns? Is it poverty? Is it substance use? There's so many things. Lack of education, not knowing how to maneuver the healthcare system, the health literacy concerns, all of those things. And so as a public health nurse, you're kind of a detective, and like going into that environment and trying to figure out the root cause, and then not only providing the services to that particular patient or family, but then also on the behind the scenes aspect of that, you're looking at, how do I resolve the issues that are leading to this problem that I have right now? And so really addressing, is it because they are in a community that doesn't have a grocery store, so they don't have healthy foods? Is it that they can't get their kids to school because they don't have transportation, and that's why they can't get to all these other resources? And so it's more than just taking care of the ailments of that person like you would in the hospital, but really resolving the whole picture, to make sure that ultimately they have optimal health.
Yeah, and I know Emlyn brought up, the issue of having trust, and you talked about how you have to form those relationships with your patients. Um, but I was wondering, so back in the COVID-19 pandemic, that was obviously a big time for everyone. But what role did you play as a public health official during that pandemic, and what impact did that experience have on your role as a public health official?
I have been in public health long enough that I had, worked through H1N1 and SARS and MERS and anthrax and Ebola and Zika and all of those things. And of course, they were impactful in my career, but nothing like the COVID-19 pandemic. And unfortunately, the pandemic brought out the worst in people. And so public health officials, we were responsible for implementing policy that was made at the state level, and every state had different policies. And so at that particular point in my career, I was in California, and that the state politics in California really took the mitigation of COVID-19 to the nth degree. And so to the point that borders were closed, people weren't allowed in and out of the state, everything shut down, businesses, schools, everything. The vaccination was really pushed hard. But with that, there was a lot of pushback. And so I had picketers, the health department was vandalized, I was stalked, I had death threats, my house was vandalized. It got to the point that I couldn't even go to the grocery store because people would attack me. And so it became a very challenging time to navigate, in that also as a public health official, I was obligated to uphold the policies and laws and things that were implemented by the state and federal government, and utilize the funding in the way that it was prescribed, but then also reported to a board of supervisors who didn't always agree with the mandates of the state. And so there was that dichotomy of trying to uphold public health law and appease the people that I reported to. And so it was a very difficult time where sometimes people didn't always believe in the science. And there was a lot of conspiracy theories and whatnot. And so building trust was critical in that point of my career. And so luckily had been in that position and had community partners and such, because some of the hardest hit communities were communities that were more marginalized and had a distrust of government anyway. And so it was critical to have those partnerships with, community leaders, whether that was faith-based leaders or nonprofits or whatever, that could help get the vaccine out to those populations that we knew would have worse outcomes if they actually got COVID. So lots of lessons learned, lots of resiliency. But yeah, a lot of people left the field of public health after the pandemic.
Yeah, that's definitely stressful and frustrating, but also kind of dangerous period for you. So I did kind of want to follow that up with one question about trust. So the lack of trust and, sometimes even hostility of the American people towards public health clearly has negative effects for both Americans who feel like, they can't trust public health agencies or even other parts of the government, but then also for you guys who are working in public health roles. So what are some of your major concerns that surround that issue?
They will definitely have some concerns about where public health is going to be in the future. One of the things that's very unfortunate about public health is that it's traditionally underfunded, and how public health operates is very much influenced by politics. And that's also one of the things, as a public health nurse, you become very savvy at building partnerships and whatnot to have bigger impact, because the work of public health is never ending and you can't do it yourself. And the funding isn't always there either. And so it's all about being creative and collaborative, and really having that resilience to weather the storm, because, the political influence and the funding is always ebbing and flowing. And I think that hospital nursing, you're more insulated from that, where public health is very much impacted by those changes in federal government, state government, county government. That all impacts how you do your work. The work is still there. You just have to find creative ways and partnerships to make sure it gets done.
Yeah, that's very interesting to hear. I remember there was definitely a lot of pushback and retort against like public health officials. But I don't think a lot of us realized that it went to the point of like making physical threats to safety and stuff like that. So yeah, just sort of to summarize this section in general, it does sound like this was an extremely frustrating time in your career, especially for the sake of your own health, and because um, you've had a very long career and you sort of hone in and like become more specialized in what you want to practice and what you want to pursue. And I'm gonna guess it was probably very frustrating to be very passionate about public health and then to experience so much like dissent and pushback. Um, so yeah, some of the things that sort of caught my attention while you were talking about this was the dichotomy between protecting your own health and getting pushback from other like leaders as to how to proceed in many cases. And also the idea that like each state during a pandemic has different protocols to follow. But as you know, like viruses know no bounds, they don't know like geographic borders. So I think a lot of people alive during the pandemic can relate to this idea of like just confusion and hypocrisy because they're being told so many different things. Um, but yeah, maybe this question's outside of your scope when I ask like, how do you feel that we could make the system better? Not just perhaps like not for everyone, but I feel like especially perspectives like yours definitely hold a lot more weight as to how, like, if we were to face another pandemic, what could we have done better to avoid some of these issues in the future?
Yeah, I think having a consistent message grounded in science and evidence is critical. I think that honestly, a lot of the work that I and my team had to do during the pandemic was really paying attention to what was happening in the media, and debunking a lot of the myths that were put forward and the conspiracy theories, and making sure that people had access to accurate information. And the biggest difficulty with that during the pandemic is that we didn't really know. We were learning as we went. And so, messaging did change as the pandemic went on into the second and third year, because we had more information about how the virus reacted and how effective the vaccine was and things like that. But it was really critical to stay on top of that messaging to make sure that not only were we sharing the message as we had the information, but assuring that it was shared in a way that everyone could understand it and digest it. And so, really making sure that the message was tailored for different populations, whether that was different communities with different cultural norms, or, making sure that it was presented in a manner that wasn't too scientific, that people could actually implement the recommendations.
Yeah, and that's probably not an easy, it's not going to be an easy shift by any means. But it is worth it to hear what you guys have to say. Just because, in the event that that does happen again, we do want to be more prepared as, American citizens, but also, if we go into medicine, we want to be part of that change. But we are coming up towards the end, so I'm going to ask one more question, and then Emily's going to ask one more question, and then we'll kind of close it up. But based on what we've heard, you've had an incredibly nonlinear path on your journey in medicine. So, you started off wanting to be a veterinarian, joined the military, worked as a combat medic and an EMT, and then went into nursing. And then once you were there, you didn't just work as a nurse. You also went into public health nursing and then got more involved in the public health sector. So I think a lot of people are, some people know what they want to do and that's what they go for. And then others don't really know what they want to do. Then there are some people that get involved in something and then decide that maybe it's not the right path for them. And I think a lot of people are, scared to go through so many career changes and they're not really sure if it's the right decision for them. So what advice would you give to someone who, is maybe currently in a job and doesn't feel fulfilled or feels like they could be doing something more and is trying to make a switch from what they're doing now to maybe a different career path?
Well, if you're talking about specifically nursing, that's the best part about being a nurse, is that you're not stuck into one area. And so, I think that there's no wrong opportunity in nursing, and it's totally okay to say, you know what, this type of nursing isn't for me, but that doesn't mean that nursing isn't for you. And I think that every single experience that we get the opportunity to experience in nursing really just builds who we are and how we show up as a nurse. And so, we get better bedside manners, but we also gain experience on how to build those relationships and trust with not only our patients, but our community, if public health is the way you want to go. And so I really think that, try out an area, whether that's a specific floor in the hospital that focuses on, maybe oncology or ICU or whatever. And if it's not for you, that's okay. There's so many other areas of nursing. I just really implore people to really honor the profession as a whole, and really strive to, continue to grow in your career, and instead of being frustrated with the area and jumping out of nursing into something altogether.
I think that's great to hear. I think when people think of nursing, it's a pretty narrow scope, and we just aren't quite aware of how broad the field itself is and how people can get involved in nursing in so many ways. So for the final question, it's something that we ask all of our guests on this podcast, and it's very basic. It's just, what does a day in your life look like? And for you, this might be a bit more of a complicated question because I feel like every day looks different for you. So if you want to focus on a specific time in your career or a specific project or initiative that's been particularly resonant with you, yeah, whatever you like.
Sure. Well, so in my role as Director of Prevention and Population Health here at Texas A&M, I would say that every day encompasses looking at data, really connecting with partners, not only just on campus, but in the community, to develop collaborative opportunities that improve the health of students. And that can be anything from attending a coalition meeting to briefing university leadership on why I think a policy needs to be changed, connecting with students to find out what areas they would like to see we focus on to provide opportunities and resources for them to achieve optimal health.
Yeah, well, so it's obvious that you've had, a very widespread impact on the field of medicine and public health. And it's been so interesting to hear how you've operated on so many scopes from, direct patient care, combat care, and expanding as wide as, the health of the entire communities. So thank you again for coming on and joining us and sharing all of your stories with us and our listeners. We had a great time.
Yeah, it was my pleasure. Thank you for the opportunity.
Big thanks to Dr. Blackwell for taking the time to chat with us today and for sharing her story. If you enjoyed this episode, make sure to subscribe to Stories Behind the Scrubs.
And if you liked what you heard, don't forget to leave us a review, share this episode with a friend, and follow us on Instagram at Stories Behind the Scrubs. We'd love to hear your thoughts and any questions you might have for our guests.
Thanks for listening, and we'll see you next time.